Have any audience members listening today know someone who has had or currently has a terminal illness? I know I have, and I'm sure many of you listening do as well. My great aunt, for example, was diagnosed with stage 4 lung cancer when I was only 10 years old. I remember watching her as her cancer slowly consumed her until she was about half her size and was eventually bedridden. She couldn't keep her food down and was in constant pain. She soon you couldn't recognize her because she didn't look like her past self. No person should ever have to live like this. Hi, my name is Brody Davidson, and my group and I are proposing that the state of North Dakota legalize physician-assisted suicide. There are currently 7 states that do this in the U.S., as well as D.C. These states being Washington, Oregon, California, Montana, Colorado, Hawaii, Vermont, and D.C., of course. Today, my group and I are going to explain how this measure relates to not only the physicians, the taxpayers, but we're also going to explain how this bill will affect the suffering patients themselves. We'll begin with Matthew explaining the medical side of the thing.
Hi guys, my name is Matt, and today I want to talk about the pros of physician-assisted suicide. So should patients have the right to decide their timing of their own death? It is the job of the physician to address the pain and suffering of the sick and dying. Cancer patients should not have to suffer incurable diseases while they waste away in tremendous pain. It is simply inhumane. We do not make animals suffer at the ends of their lives, so why would we ask this of our patients? Prolonging a patient's life who has an incurable illness prolongs their suffering, and it's disturbingly offensive. When such patients ask for assistance in exercising their right to die, their wishes should always be granted. Our medical systems are overburdened. There are not enough resources to go around. Hospitals are overcrowded with too many patients. We have grieving families at patients' bedsides, witnessing tremendous suffering as their loved ones endure incurable diseases and overwhelmingly painful illnesses. The financial burdens of lying in a hospital or a nursing home bed without any quality of life has taken a tremendous toll on the finances of the patients, their families, and the medical facilities that provide for them. 57% of the physicians practicing today have received a request for physician-assisted suicide. Physicians should be allowed to let those die who do not have a chance of living on. This action would provide more room, resources, and funds for patients with diseases that can be cured. Attentive and caring physicians have long practiced passive euthanasia to withdraw treatments such as nourishment or hydration to facilitate a patient's death by natural causes. Active euthanasia simply prevents suffering by assisting the patients in their choice to end their life from suffering. Physicians are healers, and when healing is no longer possible, when a patient's death is imminent and suffering is unbearable, the physician's role should be allowed to shift from healing to relieving suffering in accordance with the patient's wishes.
Talking about dollar amounts and assigning a tangible value to a life is a discussion most of you are clear of. Often these last days of a patient life are the most expensive. The patient should have a say in how resources are allocated and time spent on their behalf. The last days of a patient's life who is experiencing a natural death are statistically the most expensive. This is because of an increase in emergency room visits, doctor's appointments, and an attempt to garner some control over symptoms and pains that are a part of their illness. According to the New England Journal of Medicine, 33% of last year medical expenses are in the last month of life. For a family member who is uninsured, that on average amounts to about $15,800. Physician-assisted suicide, or PAS, shortens a terminal patient's suffering by about 3.5 weeks. At the same time, it gives patient control over final financial burdens. In 2009, Medicare spent $55 billion on hospitals and caring for patients in the last 2 months of their life. Even with insurance, the financial burden adds stress to an already trying situation. Some costs are unquantifiable, such as family, loss of work, travel, and psychological damages from watching a loved one wither away. PASS gives the terminally ill a control that seems should be an innate right. It's not a matter of someone who needs treatment simply being ignored or not having funds. These people are dying, sometimes very painfully. They're not just patients, they're people. These are our loved ones. If it's their wish to not suffer a painful death, we have a moral responsibility to assist them with this. Often a patient wants to leave behind something for the family, to make their family more comfortable and not be a burden. Medical expenses in these last often exhaust any funds saved by the ill, leaving the family with nothing but memories and bills of the deceased. In a perfect world, the responsibility of end-of-life expenses would not fall on the family, and this argument would be void. This is a moral response to the system we are currently operating in. The fact is that laws that are currently in place do not respect the dying wishes of the terminally ill. It is time we started listening and changing laws to support terminally ill patients and their families. After all, when possible, shouldn't we do our best to allow the last days of a person's life to be on their terms?
Hello, my name is Zachary Even, and I will be discussing the humanities and the experience of some different countries. To start, the Netherlands ratified physician-assisted suicide, or PAS, on April 1st, 2002. In a study by the NIH, found that 95% of families and friends of Dutch terminally ill cancer patients who died by euthanasia had less traumatic grief symptoms. The Netherlands take a much more progressive approach with euthanasia and physician-assisted suicide. They don't have a lot of government control. The doctors basically make all of the decisions themselves. And so that's a lot different than Finland, which ratified theirs on January 1st, 2012. The Finnish National Advisory Board on Social Welfare and Healthcare Ethics released this statement ratifying physician-assisted suicide, or PAS. Assisted suicide is not a crime in Finland. Assisted suicide is connected to end-of-life care when the patient takes a deadly dose of medicine himself or herself. Placing the dose of medicine within the patient's request when he or she has decided to end his or her life is considered assisted suicide. The Finnish believe that medicine is becoming so advanced that doctors can keep patients alive much longer than they want to live. As Matthew mentioned, in an age when medical technology is becoming so advanced, physicians can prolong life of a patient with a terminal illness that the suffering can become unbearable for them. The Finns have taken a much stricter approach than the Dutch. In Finland, there's a lot of government control regarding PAS. They need government approval before a patient can be a candidate for PAS, as well as the medications for them must be approved. And in Finland, the doctors essentially just set the lethal dose of medication beside the patient, and the patient has to physically take that medication themselves, whereas there's no intervention by doctors effectively ending their life. For the United States, the topic is very controversial right now, I'm sure, as we've discussed. In a research article published by a group of physicians, found a total of 988 patients that were interviewed, found that 60.2% supported physician-assisted suicide in a hypothetical situation if it had been ratified. The U.S. shouldn't be about promoting PAS or promoting euthanasia at all. It should just be giving the option to the patients if that was a route they chose to take. The U.S. should structure their system more like the Finns, with high government control and high patient awareness and decision making. For instance, like the patient should make a final decision and take the medications themselves, such as the Finns do. According to Oregon's Public Health Services, the most frequent cited sources for choosing assisted suicide are 96.2% of decreasing ability to participate in activities that made life enjoyable, 92.4% thought a loss of autonomy resulted in them deciding PAS, and 75.4% saw a loss of dignity resulted into them choosing PAS. and here are my sources. Thank you.
I hope today that you all gained a better insight about what we are proposing, as well as the reasoning behind it. When you combine all of the pieces together, the picture it creates makes much more sense. North Dakota has all of the pieces. We just need to put them together. 7 states, as well as our nation's capital, are seeing the picture. On Election Day, we hope that you too will see our vision to create a better North Dakota for all that live here.